Hello, this is Professor David Bishai speaking, and in this short video I'd like to describe the collective impact approach and how it could be useful in the work of Project Samuday. So I'd like to introduce the collective impact approach using a short video that was produced by the Collective Impact Forum and the FSG Consulting Group.
The number and complexity of challenges facing our world can be overwhelming. When individual organizations attempt to tackle the most daunting problems, success stories are all too rare. Many innovative approaches have been tried, too few have worked. However, when organizations work together under the right conditions, they can accomplish great things. One particularly effective means of collaboration is collective impact. Using the collective impact approach, a number of complex social challenges have been addressed and some remarkable results have been achieved. Youth incarcerations dropped by 45% in just 3 years, with no change in public safety, improving the lives of thousands of youths. 6,000 public housing residents were placed in new jobs during the recession. More than 1,000 acres were restored and over 280 million pounds of pollution voluntarily reduced to conserve and restore a river. Organizations utilizing a collective impact approach do the following: agree to a common goal, agree to track progress in the same way, which allows for continuous improvement, do what each does best while identifying new ways to work together, have consistent communication, and finally, have skilled and dedicated resources to support ongoing efforts. The world's toughest challenges aren't going away. In fact, many experts predict they will continue to grow in both number and complexity. Solving these problems requires a range of expertise from a number of diverse organizations. Collective impact is a proven approach, helping organizations work together to move mountains.
So as we saw in the video, collective impact has been used around the world, and we'd like to describe the rationale for using it in Hardoi District. In Hardoi District, there are village health, sanitation, and nutrition committees present throughout Hardoi. These committees have the potential to be a platform for public health work. They are, by design, multi-sectoral, and they are designed to be data-driven. They are designed to engage politicians, health sector officials, school officials, water, public works, and all of the NGOs working in areas related to health. They are designed to convene these members to respond to the leading health threats in a village, to prevent disease, and keep women and children healthy. So if there were to be a platform for collective impact, it would be the village health, sanitation, and nutrition committees. So why intervene? Well, obviously, many of us know that the village health, sanitation, nutrition committees are not living up to their potential. The evidence collected in published studies from Rajasthan, Jharkhand, and Orissa is that there is underperformance. The supportive supervision for the ASHA workers is weak. The ASHAs get little guidance in how to convene and how to get these multiple agencies to work together. And there's poor support to the committees from the higher levels at the blocks or district. However, when they work well, they work really well. And strong village health, sanitation, nutrition committees have led to tremendous progress in other states in India. The National Rural Health Mission provides a plan for better NGO involvement in improving the function of village health, sanitation, nutrition committees. And that is exactly the place that Project Samuday should be working. So what would be the role for Project Samuday? Well, if we understand collective impact, we need to convene, and the first step would be to prepare an inventory. And in the baseline survey that is going to be launched in 2017, the survey module will detect groups and organizations that are related to health. There will be a community module that would help us list the schools, temples, mosques, police departments, public works, political groups, etc., that have a role in each village work of public health. With that inventory, we could help the local ASHAs do a better job of convening. and we plan to train ashas and panchayat personnel in getting more out of the meetings and the organization of the village health, sanitation, and nutrition committees. We'd like to train these individuals to make access to the data on that local health problems. Some of this data could be coming from the Johns Hopkins study, but other data is available from the blocks and districts. When these committees are functioning well, they will get input from all groups on the local priorities, and they will form a village action plan for health. It would be the role of Project Samuday to involve all of the partners, to keep them engaged in their tasks, and to help them develop their respective roles. And then this would be done over time. The action plan would be revisited, and the various members of the collective impact would stay on mission. So as we saw in the video, there are 5 core conditions for collective impact, and the first one of establishing a common agenda. That agenda will be developed by these newly empowered village health, sanitation, nutrition committees. The second is to help the members of the collective develop shared measures that they agree on, and this would also be the work supported by Project Samuday. There needs to be a coherent plan. The third step would be to engage the mutually reinforcing activities by all of the members of the Village Health, Sanitation, Nutrition Committee. They need to be kept in communication, and some of the training that we would provide to the ashas would help keep their communication going. And fifth, they need to have backbone support. And again, here would be the role of Project Samuday in helping the asha workers and their members of the VHSNC be better facilitators and more engaged with the support they're supposed to receive from their blocks and districts. So how does this connect to the broader portfolio of Project Samuday? How will these health plans by the villages connect to the other things that Project Samuday wants to do? Well, I don't see this as an either-or. These village health plans, if they're properly cultivated, they will be authentic and valid expressions of the people that we mean to serve. And if the plans are good, they will be based on the priorities of the people and use their own pre-existing resources as well as those that Samuday brings to help them unlock their current strengths. Frankly, the village health plans, if they are of high quality, must be used to help inform what Project Samuday wants to do. Otherwise, sustainability will be lost after Project Samuday exits the stage. This is the scalable plan that we know well in public health. We must be involved in the priorities of the local people. So Project Samuday can help to steward and forward each village's plan. In terms of the evaluation, Johns Hopkins could be involved at the early, middle, and late phases of the evaluation to observe who is being engaged and give feedback on how to improve that, to improve the level of engagement and to help develop the project. During the middle stage, we could help to observe processes of systems change and behavioral change and help feed that back to the village health, sanitation, and nutrition committees. We can document impact because knowing impact is helpful to sustain the collaboration. By summarizing what happens, we can inspire others. So evaluation is not done separately from program implementation. It is done as part of performance improvement. So in conclusion, health requires both curative and preventive services. We want these villages to work on creating conditions that keep the people healthy, and that is the essence of the public health approach. These village health committees are the foundation of the strategy laid out by the Indian government to prevent disease and promote health. To get them to work better, the collective impact strategy is well aligned with a goal of strengthening their performance. Collective impact offers a superb and scalable role for Project Samuday to intervene. So I hope this brief video has developed some curiosity. Johns Hopkins has produced a 10-page concept note outlining more details about how we could move forward with this agenda. Thank you very much.